Hello everyone, my name is Saul Diaz. Today I will be presenting an overview of invasive ductal carcinoma of the breast. I am interested in presenting this condition because it affects many women and men around the world. I will discuss the role mammography and computer tomography play in the imaging and diagnosis of this malignancy. Lastly, I will discuss how these modalities can further benefit the patients affected by invasive ductal carcinoma. Invasive ductal carcinoma is the most common type of breast cancer. This condition originates in the middle ducts of the breast and invades the surrounding breast tissue. The word carcinoma refers to a cancer that originates in the skin or any tissue that covers internal organs. Invasive ductal carcinoma of the breast is the most common type of breast cancer, encompassing 80% of all breast cancer cases. According to the American Cancer Society, even though this condition affects women of any age, about 2/3 of women are 55 or older when they are diagnosed with an invasive breast cancer. The imaging abilities of computer tomography and mammography play an important role in the diagnosis of this condition. Both of these modalities are used to locate and diagnose invasive ductal carcinoma respectively. The interesting fact about invasive ductal carcinoma is that it originally starts asymptomatically and it is detected during a routine screening mammogram. Other cases are detected in the form of a new lump or mass in the breast. According to the American Cancer Society, other invasive ductal carcinoma signs and symptoms include swelling of the breast, skin irritation, breast pain, nipple discharge, and other than breast milk, and a lump in the underarm area. Invasive ductal carcinoma of the breast is usually diagnosed by performing a biopsy of a tumor previously detected by diagnostic imaging. One of the biopsy options involved a fine needle aspiration process that inserts a small hollow needle into the breast to remove a sample which serves to be further diagnosed under a microscope. After the confirmation, cases are staged according to the American Joint Committee on Cancer TNM system, which evaluates the tumor size, the spread to the lymph nodes, and the involvement of metastatic disease. The treatment options for invasive ductal carcinoma of the breast include local and systemic approaches. Surgery and radiation therapy provide a local treatment option, while chemotherapy and hormonal therapy provide a systemic approach. According to the American Cancer Society, surgery removes the breast tumor and checks for spread to the local lymph nodes. The type of surgery may include a lumpectomy, which removes portion of the breast that contains the tumor, a total or simple mastectomy, which removes the total or some of the breast tissue with no lymph node or muscle included, and a modified radical mastectomy, which removes the entire breast and laning of the chest wall muscle and lymph nodes. The radiation therapy treatment option is a local treatment approach that uses high energy X-rays to target the entire breast and surrounding tissues. Invasive ductal carcinoma is usually detected with a mammogram, which is a test that obtains X-ray images of the breast. Mammography is used to screen signs of breast cancer. On the mammography films, the doctor sees an abnormality with finger-like projections coming out of it. The projections show the invasion of the cancer into the other tissues. During a mammogram, patients will be positioned by a technologist. Patients can feel uncomfortable due to the pressure that is required to flatten the breast tissue to take the image. According to Washington and Lever, mammography is the only modality that routinely detects breast cancer if the lesion is too small to feel during a clinical examination. The strength of mammography is that it is arguably the most important tool doctors have to screen for breast cancer. and also to diagnose, evaluate, and follow people who've had breast cancer. A computer tomography or CT scan uses combined data from several X-rays to produce and reconstruct a detailed three-dimensional image of structures inside the body. Computer tomography is an important tool for the evaluation of local and regional disease in selected patients who have an established diagnosis of breast cancer. Large breast patients benefit from a CT scan that assess whether or not the cancer has moved into the chest wall. This is helpful to determine whether or not the cancer can be removed with mastectomy. In addition, a CT scan is able to examine other parts of the body where breast cancer can spread, such as the lymph nodes, lungs, liver, brain, and the spine. It is common to not make use of CT scans for early stage breast cancer. During a CT scan, the patient will be positioned by a CT technologist who is performing the scan. Patients will lie on the table inside a large round-shaped CT machine. As the table moves through the scanner, patients experience a buzzing noise which is caused by the rotation of X-ray sources. It is very common for patients to feel intimidated just because the machine is very big and noisy. So it is important to make the patients feel as comfortable as possible. One of the major sources of contention of mammography is the disagreement concerning the ideal interval for screening. The American College of Obstetrics and Gynecology recommend that asymptomatic women between the ages of 35 and 39 who are at an average risk for developing breast cancer should obtain a baseline mammogram. Unfortunately, due to medical insurance coverage, many patients under the age of 40 are not covered. While several health organizations issue guidelines for breast cancer screening and prevention, private insurance coverage of preventative services under the ACA is governed by recommendations from the United States Preventative Services Task Force. In addition, some medical professionals recommend other services such as screening of MRIs for women at higher risk for breast cancer, but these services are not currently subject to the ACA's Preventative Services Coverage requirement. Insurance coverage for screening of younger patients is essential in the fight to save their lives. The government must pass legislation that aims to reduce the age of an individual that would be covered to do a mammogram and be covered under their insurance. In conclusion, invasive ductal carcinoma of the breast is a dangerous malignancy that affects the lives of many people. Imaging modalities such as mammography and computer tomography provide excellent tools that lead to the detection and diagnosis of this condition. We must continue to work to expand coverage to younger women as many cases emerge among them. Thank you for watching.